guys, so we can continue. What were we saying before? What was the topic of discussion?
Leadership.
Yeah, you were giving feedback on leadership.
Yes. So we're giving feedback on leadership. So so who wants to go next? Yeah, somebody should just go next. So we'd have the.
Okay, can I go next?
Yeah, please go next.
What's the question, please? Can you ask the question?
So the question is, sorry, I'll just read the question again. Just a minute. The question is actually the question that you have already, like the normal Chevening question, but let me just read it here. So it says that Chevening is looking for individuals who will be future leaders or influencers in their home country. Explain how you meet these requirements with clear examples of your own leadership and influencing skills to support your answer.
All right, thank you very much for that question. Can you hear me?
Yes, we can.
Okay, thank you.
Can you hear me? Before Chris goes, can anyone hear me?
Yeah, I can hear you.
I think aside this question can also be asked in different ways, right? So my own the way it was asked for my own interview was, can you give with one example only, right? Tell us how you were able to demonstrate leadership and influence in your professional or personal life. So it mustn't actually come the way to medical. It can come in different ways, and that's one of the things that actually throws off some candidates of balance, right? So in your mind, you would have just been waiting to hear exactly that question. You wait to be asked it like a few examples of the examples, and then some people get surprised when they are not asked, okay, can you tell us with only one example how you're able to demonstrate leadership? Or they can even say, okay, how can you give an example of one time in your life that you made a very difficult decision against a popular norm? So these are all leadership questions in different contexts. So it's something that to actually take note of, that it will come in different ways, but just be very attentive to pick out that it's actually a leadership question that you're being asked.
Okay, thank you for that. Before I go to attempt the question, I was going to ask concerning this last way the question can be framed, where they'll ask you to give an example of a time where you made an unpopular decision. So are they asking for in terms of you as a leader now, you made a decision that wasn't popular, you did something, or you tackled a problem that in a way that wasn't popular? Are they asking about that? Or are they asking, how will I put it now? So
I get your point. Maybe
it can be framed two ways. So one way could be like the traditional leadership way, where you are discussing a problem, star approach, and all of that. Or it can be framed in a way where you took a decision that wasn't popular and people like revolted against it, and then you had to tackle that kind of situation. So,
So not really. So what they mean by an unpopular decision was more like, yeah, from the outset it was not popular, but then you are able to then get people's buy-in to go along with it. So it's the same thing as leader. As a leader, you always face there will always be times in your life where you have to make an uncomfortable decision, but your ability to then get people to buy in is what makes you a leader. I mean, when you look at politics, for instance, you can be in the position of minority party, and then you win an election, and then the entire parliament is against you. But your ability to then gain bipartisan support for some of your policies is what makes you a leader. And initially, your policy could be unpopular, but how you're able to then get everyone on every side to sort of support you is what makes you a leader. So it's the same analogy here that they're trying to actually see in your response or answer.
Okay, thank you for that. Okay, let me go. So thank you so much for that question. I believe leadership is all about influencing people. towards the setting goal. A leader should be able to see a reality that is not apparent at the moment and be able to, influence resources, both human and otherwise, towards achieving that result. I have had opportunities to lead in various capacities and continue to do so even currently. During my time as a student, as a medical student, I was the coordinator, the leader for the outreach. I was the outreach coordinator for the Student and Medical Dental Association. And during that time, for about 4 years, and during that time, I noticed that the communities that directly surrounded my medical school had very limited access to healthcare. And this was quite paradoxical because here we were in a tertiary hospital, in a tertiary health facility, receiving, adequate medical training. And then the communities that surrounded us, had little or no access to healthcare at all. And then noticing this, I decided to address this challenge by creating the HelpCom initiative, which basically means help a community, where we began to reach out to this community to improve their health access through health outreaches. And so I did this by raising up a team of 20 volunteers. These volunteers comprised a mix of both medical students in training and also established doctors who were in their undergoing a fellowship to become consultants or specialists. I did this by partnering with other associations such as the Association of Medical Students in University of Lagos, and also partnering with the Association of Resident Doctors of Nigeria in my college. And so people who were interested in reaching out to these communities, came on board, and then we began to, reach out to these communities and provide health access through simple health outreaches. And outreach basically involved us going ahead to the communities, familiarizing with ourselves with them, picking a location. Usually would be a primary school or secondary school that had a wide open field, and then coming on the day of the particular day of the outreach, and then setting up a mini clinical flow, which will usually involve patients coming in. We do a quick physical check on them, and then check for common things like that, diabetes and hypertension. Then go on, if we have a dentist on the team, we go on to do a simple dental check, and then they get to speak with the doctor, have free consultation, and then based on what the consultation the findings are, we get to give them drugs, if it's within what we could cover. And if it's not, if they have cases that are beyond what we could cover in a simple outreach like that, we wrote referral letters and, told them that, oh, you could just come to this teaching hospital to get more care. And through this simple initiative, we're able to reach, I and my team were able to reach over 20 communities over this period of 4 years, and improve health access in those communities. There were some challenges I experienced in executing this. For example, one of the communities that surrounded the College of Medicine of the University of Lagos is the Diaraba community. And this constituted mostly of motorcycle riders, which we often refer to as Okada riders. And this group of people are usually from the northern part of Nigeria and oftentimes speak Hausa. Because I grew up in the north and I have at least a conversational understanding of the Hausa language, I was able to teach my team basic Hausa to help them, administer healthcare to the people that we interacted to in that community. And over this period, we were able to reach over 20 communities, like I said, prevent 16 recorded health emergencies, including hypertensive emergencies, people who we saw with blood pressure of, 270, 200, 220, and tell them that, oh, just you need to get to the hospital immediately and get more care. And we're able to improve health access and health outcomes in those communities. And over time, more organizations began to see the importance of this and reach out to them. During my internship year in the year 2020, in response to the state of emergency declared by the Nigerian legislature on gender-based violence in the country, I teamed up with the Carrington Youth Fellowship of the United States Consulate with ONYETI, which was the Young and Informed Teenagers Initiative, which focused on teaching and training teenagers on reproductive health, on rape, on consent, and how to identify grooming behavior, what to do if they face those kind of challenges. And I and the team reached over 100 teenagers, which was 10 teenagers in 10 communities across Lagos State, teaching them on sexual and reproductive health, using tools such as manuals and case representations to empower them to be able to tackle these challenges. these teenagers have gone on to share with their peers the knowledge they gained from this, and it has helped reduce the incidence of gender-based violence in those communities. Currently, I lead medical operations in Wella Health, where I spearhead a team to provide clinical insights for our management microinsurance plans for treatment of malaria and typhoid. And some of the tasks that I do there is to ensure that our management plans are clinically accurate and also affordable. This has involved me introducing and creating a framework for testing and assessment for malaria, as well as teaching our health partners, such as community-based pharmacies, the importance of testing before administering treatment, empowering them to be a management center such that the pharmacy on their own can manage a simple malaria case or a simple typhoid case without the patient necessarily having to go to the hospital. This helps reduce wait time. This makes the treatment flow more effective and also more accessible, as we have more community pharmacies than specialized hospitals. Currently, we have over 1,500 pharmacy partners who are providing this service and who are using the framework which I introduced. And we have over 10,000 registered users at Wella Health who are making use of this Wella Health of the microinsurance plan. So I'm on a journey to continue to improve my influence and leadership in healthcare, and that's why I've applied for a master's in health, financing, and planning at the London School of Hygiene and Tropical Medicine, and as well as the reason why I've applied for a Chevening Scholarship, which is a scholarship that is focused on training and empowering global leaders. And I believe that these opportunities combined will improve my leadership skills and leadership qualities, as well as give me more capacity to exert greater influence in healthcare in my country. Thank you so much.
Yeah. Let me go first. Yeah, Chris, wonderful presentation.
Okay.
You had us captivate, as in I was just following your story, very detailed. I could picture everything you were saying. This is wonderful, and I also believe that you can make it even super excellent. So,
Okay.
from the first example you gave, I would say include how you were able to for the community outreaches. I believe there were traditional leaders in that community that they are sort of gatekeepers, right? It will be better to include how you're able to convince them to actually give you a support in the community to run the outreaches, because I believe you can't just enter a community and then start doing outreach without sort of getting the leadership involved. That's one. Secondly, I think towards the end of your response, it will also be, yeah, you made mention of your study at your potential course and then school, right? I think to also make it very excellent, you can include some kind of leadership position you intend to sort of play, or role you intend to play when you're in the school. So look out for their societies at the London School of Economics and London School of Medical Medicine in finance that you want to sort of maybe play a role in, as maybe supporting the African or representing the African students, right, in such a society, right? And even within the Chevening community here in the UK, are there like roles within the Chevening? So currently, I think we have so far so far we don't really. I don't think there's any concrete Chevening positions and stuff. But in your schools, right, maybe you could be the one to sort of galvanize Chevening scholars from Africa in your school, and then maybe sort of hold some kind of periodic meetings where you come together to sort of provide updates on how far you've gone with your studies, and then whether you're still in alignment with your future career objectives. So helping the African Chevening community in your school to sort of keep on track with their what's called future plans. So when you include some of these things, I believe you me, you're going to have a very excellent leadership response to the question. Well done so far. You provided a very good example of what response should be to the leadership question.
Thank you so much.
I think it's still breaking actually. I don't know why.
Wow.
It's still breaking, but I think it got most of what you said.
Yes, I did.
Yeah. So, Chris, great one, really, like very nice. I'll just add some points. I like the fact that you mentioned a problem you identified even while trying to solve a problem. That's the part where you talked about you had to train your colleagues on the speaking Hausa, right?
Yes.
And that even helped to further help the projects that you had set out to achieve. Do you understand? So makes sense. Do you understand? Like that depicted like leadership even inside what you're doing. And that's very, very nice. One other thing I would just like to point out is that in as much as you are showing all of these things, always try as much as possible to just give like a little bit of outcome apart from your outputs.
Okay.
Right? Apart from your outputs. So in a way, it might be difficult, I know, because sometimes, all of these things that we've done, we did not really take measures. Like nobody was, when we were doing outreach in school, you understand, nobody wondered how many lives we're impacting, and nobody really wondered what these effects were on the community itself. Do you understand? Like, so you can't really say that, okay, maybe it led to a 10% decrease in the mean blood pressure among the hypertensives in that area, or it reduced the incidence of stroke admissions in Lutz, or maybe it did increase the level of health education amongst those that were hypertensive in Idiaraba, because we did not take that data, right?
Yeah.
But in a way, you can maybe from your own story, you can say it contributed to, right, an existing metric. I don't know if you get. So
yeah, I think what can be done here is, if it's possible to, maybe before you could sort of give some kind of overview on what the condition
what it was before
for your intervention. Yeah. So for
Yes.
instance, if there are available surveys like the Nigerian Demographic Health Survey, and then you relate to the Lagos State situation. So for
Yes.
instance, maybe something around for maternal health, maybe ANC attendance, right, in 2018, or as when the last survey was in 2018, right? What was ANC attendance rate, right? What was the facility-based delivery rate as at 2018 based on this survey? If there are other in-state surveys that you can lay your hands on, you can mention that as part of the things that drove you to do this. And then for outcome, you can then say maybe in the next 1 or 2 years, you believe that what you did can actually help contribute to increasing facility-based delivery from what it was in 2018 or in 2020 when we started, to maybe less than half, to maybe another 50% increase, right? ANC attendance. So just have like a reference point to actually back up your outcome.
Yes. Do you understand? So in a way, you can say that, okay, maybe there was a problem you identified before, or there was a national statistics that Nigeria was working on, and with your intervention, you believe that would have contributed to an improvement in that statistics. That would be awesome, because you're talking about something that your decision has influenced in a way. Do you understand? So I think that was a good one, and you've really realized like the points to add to make it like a better presentation. So let's play. Akinola should just give us a shot. We are far into this. So Akinola, if you are there, please just speak. So we just want to be quick, please. So guys, we might not be able to cover all of the questions, right? But in essence, the template we are given is actually going to work for every of those questions. The template we are given is actually going to work for every of those questions. So in case you are speaking on any topic, just do this. Try to use the STAR approach. But when you're using the STAR approach, always note that the most important things that you want to address are how you did, how you effected, what was your own inputs, what are the things that you did, how did you influence people, how did you cause a change? How did you lead to? Someone sent a message. How did you how did you started a relationship that led to something? Okay, so let's just go on.
Yes.
Suraksha.
I think subsequently, what we can do is for the next questions, maybe one person or two person at most can give us their response.
Okay.
Save time, right?
Okay. I think we should just go on to the next question then. Let's go on to the next question. We'll go on to networking question. Then Suraksha would be the one to speak. So we'll go on to the networking question. Then Suraksha will be the one to speak on networking. So Suraksha, you're going to speak on networking. Let me just read the question to you and would allow you speak so that we can end on time, please. So Chevening is looking for individuals with strong networking skills who will engage with the Chevening community and influence and lead others in their chosen profession. Explain how you meet these requirements using clear examples of your networking skills and outline how you hope to use these skills in the future. Now, before you give your answer, let me just quickly point out the most important things here, please. Chevening is obviously looking for individuals with networking skills. That one you cannot negate. And what they want these leaders to do is that they want them to engage with the Chevening community, because there's really a Chevening community, right? And they want you to be able to influence and lead others in your own field and in the Chevening community, right? So now they've told you what they want. How do you think you meet this requirement? And how? Just give us examples, right?
So I think I also framed the question in a different way. So I was asked this question in a different way, and it was after talking about based on my introduction, like you said earlier. The question was like, oh, you have a lot of experience, right, and expertise. So how would you leverage this experience and expertise to sort of make an impact or contribution to the children community? That was how the question came.
Yes.
So, I mean, if you were zeroing your mind on the standard question and you're not careful,
Yes.
you off balance, right?
Yes.
So bear in mind that, like you said earlier, these questions can come in different formats.
Yes.
But just know that they're just testing. Just know the keyword there, networking. That's just what they're trying to sort of test.
Yeah. So they can actually twist the question in another way. But in essence, like I explained just now, what they are looking for is that they're looking for people that have networking skills, right? And what they want to do, what they want you to do is to influence the Chevening community. So just tell them, okay, how are you a networker? How would you use your networking skills to influence Chevening community? Simple. So please, when you're going to answer your question, make sure that you touch on what you've done in the past, and more importantly, what you would do with those skills in the future, but particularly Chevening community. Like, you cannot answer this question without mentioning the Chevening community. If you don't mention the Chevening community in this question, I think you have goofed. So please, Suraksha, just go.
Okay, thank you so much for the question. So, networking definitely for me is building connections with the people from diverse groups, and where I can learn and share each other, through which we can maintain a relationship. So, I see networking as an opportunity to build collaboration and work together for a joint vision. So, sharing a networking experience of mine, I guess very recently, when I received award for actions for SDGs, for taking actions for reducing inequalities, the award let me meet with a lot of people from different fraternities, development sector, INGOs, UN agencies, government officials who were partners to the event, with whom I got introduced through the event itself. So I made connections with those people as I collected their visiting card, sent an individual email to them expressing further support and uh, collaboration for the project that I undertook and I got awarded as. So I was invited by UN volunteer country coordinator Mr. Bisam Gawali for the further collaboration. So this was an opportunity as well as challenge for me because I needed to present my work and express for further collaboration. So I strategically reached out through them through formal and informal meetings and connecting with them in the social media, where I got to know about their interest and also expressed mine. So with all these, I received a technical support as well as a fund for the implementation of information communication and technology skills training for young persons with disabilities, through which I was able to provide training to 150 youth with disabilities and enlarge the training to two major cities in Nepal. So during the pandemic crisis, I was able to mobilize this network to solve the issue of accessibility. So when I was working as a project officer for National Network of Disability Organization for Disability Inclusion in Disaster Response Program, I realized that around 60% of persons with disabilities who are under the category of severe disability have no access to pandemic information, and they are facing barriers in receiving access to essential healthcare. This was evident through my case study reports. So I mobilized the network and built the partnership with the focal person of disabilities in the 7 provinces of Nepal. I made connections with more than 50 organizations of persons with disabilities, the resident of the district, through virtual medium, as there was no physical connections during the time of lockdown. So I connected through them through phone calls and messenger call and collaborated with them to bring solution to the issue. I learned from them about the scenario of the community and perspective of the community people as well as municipality toward the issue. So learning from all these and in coordination with them, I was able to support a policy dialogue between mayor of the municipality, representative of the community, departments, and persons with disabilities, and held a discussion on accessibility of the communication materials, isolation and quarantine centers, and influence the municipality to set up an inclusive committee having persons with disabilities in the COVID-19 control and prevention committee, which is mandated by government of Nepal. So as a result of which, inclusive committee of containing 11 persons with disabilities was formed, and they could raise their voice and opinion about their needs, and through this, the pandemic awareness was reached to the previous unreached places, as well as a mechanism was formed where they can raise their voice if anything is wrong going on in the municipality regarding inclusive COVID response. So with my negotiation influencing skills, I could bring a multiplier effect in the municipality. Therefore, through the Chevening network, I'd like to leverage the Chevening network to build solidarity for the inclusion and accessibility and put my ideas into action to ensure access to health in the people and solve the global health challenges. Thank you.
Yeah. Thank you, sir. Yeah, thank you for your presentation. I have a few feedbacks for you. So I would say, well done for your attempt. To begin with. Then the question was, how would you leverage your networking skills to make an impact within the Chilean community? And I would say that you dwelt so much on what you did in the past, which is nice. But when you and then spend just a very small portion of the time on what the question was actually all about, which is your networking skills within the Chilean community. So you made mention of yeah, an event you attended and you met the people at that event, you exchanged business cards and then emails, right? Then you went ahead to get connected with the UN person, but I didn't hear the part where this UN person you got connected with, whether it was at that event. So whenever you give an example of a critical meeting point, right, with someone of significance, you should actually give a historical context as a historical context on when and where you met the person. So this UN person that you met didn't tell us whether it was at that event that you met the person. It didn't tell us whether it was through the email exchange or it was through exchange of business card that you met this person, right? It's very important because networking skills is actually how you're able to build relationships. And most times you can build relationships over the internet or social media. It can be during an event when you're trying to meet new persons, and then you sort of strike up a conversation, and then you see that what you're working on align, people have the same interest, and then it leads to exchanging contacts, which can be email contacts or business cards. And then how you then follow up with this person, right? Maybe your conversation was more like, okay, you have a project you plan to work on in the next 6 months, and this person, oh, I've done something like this in the last 1 year. And then maybe if you're when the time is you just put me in the loop, I can help support you in this way. And this person then connects you with another person that is very strategic for you to then actually execute your project. So you can talk about these things like I've said now. I didn't the way I'm saying it now, it didn't come out clearly from your own story. Then with that, then bringing that to the children community. You made mention of you're going to sort of establish access to you get most of your examples or your story was more like generic. It wasn't really customized or specific to your context based on the story you give. So you could have said, since you worked on disability and access to care for persons with disability, maybe coming to the children network, maybe it could have been to say, okay, I'm going to leverage this my past connections and my experience in improving access to healthcare for persons with disability, access to health information for persons with disability. I can bring this experience to the children community and establish some kind of maybe children with disabilities network where I will sort of use my influence to sort of bring a voice, give a voice to children who have one form of disability or the other. I mean, there are children currently who have one form of disability or the other, and children is quite heavy on supporting them. In fact, in Nigeria, there was a special program for them recently, right? So you could say in the UK, you can actually use your experience to establish a network that will give a voice to children with disability. That will sort of kind of create a network of support for them among each other, among other children, between their network and the school. So whatever problem or challenge they may have in their social life, in their school, or even with their coursework, that network will come in to actually support them, be a voice between them and their school management to help them actually solve their problem. So you've seen how I've made it quite very explicit. So disability is a very big area that, if you're able to actually crystallize your story very well, you are going to actually stand out. So my feedback is for you to then take this feedback I've given you now, just the way I've said it, and then try to fine tune it more and say, based on my own experience, if I can even give statistics, if you have an idea of how many persons with disabilities who are currently Chevening Scholars or who are achieving alumni, you could say from your country, you could say you're going to sort of create a network in the UK when you're in the UK, and then reach out to past Chevening Scholars who have one form of disability or the other, and then put all of their network together to create a network in the UK for Chevening Scholars who have one form of disability or the other, and they use that network to galvanize support for them in their coursework, in their social life, and even between the UK Foreign Commonwealth and Development Office and these people, right? And then by doing that, you can even help bring in the UK government support for persons with disability in your country. So when you make mention of these things, they will begin to see that you've actually done your own work, you have experience in this area, and then Chevening will be making a big mistake if they don't give you the scholarship to sort of bring this network to the Chevening community. Thanks.
All right, thank you so much. That was really, really powerful, right? So yes, Suraxia, like Okeychukwu said, it's very important that like you did well. Do you understand? You did very well, but it's very important that you show where you met people, the platform that gave birth to every relationship that you're mentioning, because showing that is like showing your workings. right? You can say, okay, for instance, I connected with you on Twitter. You understand? I connected with several other persons on WhatsApp, on Twitter, on maybe through cold mailing them or through LinkedIn. Mentioning those platforms is very important. It could be at an event, it could be at maybe a gathering of leaders, it could be at anywhere. You have to mention that, right? That's one. And also, how did this relationship start? Then what are the things that this relationship has bettered? So what has it given birth to? What are the results of this relationship? That's another thing. Then also it's important to also reveal multiple examples, right? Not just one or two examples. And when it comes to Chevening community, you have to not just give, like you said, a generic answer. You have to behave like or portray that you are somebody so influential in the Chevening community already. Like maybe you can just even see yourself as the Chevening community's president. And if you were that person, what would you do? Do you understand? So if you were the person that everybody's going to listen to in the Chevening community, what would you do? That's what they want to hear. Do you understand? So if you are the most influential person in your community and Chevening community, what are the opportunities that are available to you? What are the things that you would want to do? Those are the kind of things that they would want you to say. And really, if you do this, I think you would probably ace that question. I think we should allow Chris has spoken in the previous, and Akiola can't speak. So I think we just go on to the next
Sorry,
question.
can I interrupt? Sorry, sorry. Thank you so much for this valuable suggestion. Yeah, I really can feel what you've said, and it's very true. I'll be mindful of this thing. So one question I would like to ask that
Okay.
while I was mentioning my networking example, so what I was trying to bring in is like how I network with people, like how do I network? What is network for me? How do I network? And how have I utilized my networking skills in a pandemic crisis and what impact it has made? So this is the sequence that I maintained, and I want to know if that is okay because I have exactly mentioned the same in my essay, but just that it's an elaboration of how did I network and what
Yes.
impact did it make. Mm,
Yes. It's good. That's actually like the sequence. But what we are saying is that you have to like expatiate on it. Do you
mm,
understand? You have to like give more life to the story. So believe you me, what you've written in your essays are all true, and that is actually what brought you to this interview stage. But it's important that you then put in they used to call it jara, you understand, like the extras, do you understand, the addendum. You have to put in those things to make what you have in your essay is a skeleton. You have to give it body and breathe into it to bring it to life. Because you can just read all of that and people will just be like, well, we don't believe her. But when you show it, when you give context, like Okechukwu said, when you give context to everything that you've said, everything that you've written, everything that you are explaining, then they understand more that, okay, yes, when she said that she met or she created this relationship, okay, so this relationship started on Twitter. And from Twitter, she met with this one and this one. She brought about this relationship. This relationship then started this. Then beyond that, that relationship then led to this program. This program led to this. You are giving more context. I don't know if you get. You are giving more context, and you're showing how you were able to influence. Your influence in that relationship was the key thing. And
Yeah.
mind you, also mentioned. Okay, sorry. Mind you, also mentioned Chevening community, like in a way, you may be thinking, okay, you're not in Chevening community yet, you don't have maybe that leverage. You have to think like you have that leverage already and what you're going to do with it for you to be able to use it. Another thing is, it's also good to mention, for me, I did, it's also good to mention meetings like this that we're having. okay, in this meeting now, how can you talk about networking? The fact that you networked with myself, Okeychukwu, Dotun, people that are from different continents. I'm from Africa. Okeychukwu is from Africa. Most of us are from Africa. You are from Asia. You can mention the things like that. Okay, the fact that you network with us and you've had this kind of opportunity to connect with fellow Chevening scholars, prospective Chevening scholars, and what you are how you are open to, maybe bring in disability management into other places, how you're able to bring it, how you are hoping that we're going to be a voice for disability, those with disability in the Chevening community, and all of that. It's an example how you've been doing that with fellow Chevening scholars in your country, and those that are going to be maybe those that are past scholars in your country that are working with persons with disabilities, or how you are hoping to start up an organization that would, or a community for Chevening scholars that are working in the field of they're working with people with persons with disability, and how you're hoping that your agency will do this and this and this, right? So okay, please just
So I would say again, it's good to give examples, several examples. But for me, I think if you focus on 2 or 3 examples and do a very good job of detailing every step, you actually score a lot of points. How do I mean? So networking, like you said, you defined it and everything is very fantastic. I don't know how the panel is in India. In Nigeria, I mean, in my own example, you're supposed to actually mention names of people that you met, their organizations, the position they occupy, because one of them could probably be checking out these people with their laptop computer or tablet computer as you're saying this to actually verify whether they are saying the truth or not. So it's very important for networking. They want to hear names. They want to hear organizations that these names belong to. They want to hear the roles that these people play in those organizations. To actually say, okay, have their roles and the organization were able to sort of play a role, have an impact in your networking skill set. Again, it will be important to maybe listen to the question very carefully because it says your networking skills and then how you're going to bring that to the children community. So your actually demonstrate your networking skills in the past.
The
Fine.
voice is, I really couldn't catch the time. I think it was, your voice is breaking.
Is it better now?
Not now, it just happens in between. Yeah.
yeah, it's better now.
Okay. Okay. So I was saying it will be important, right, to listen to the questions very carefully. So the question says, tell us about your networking skill set or experience, and then how you are going to leverage those skills to make an impact in the children community. So these are like 2 stop questions with in total. So you talk about your sequence of your networking skills, which you actually demonstrated to some extent. But secondly, is then focusing on the children community or even on the UK as a whole. So how will your networking skills make an impact within the children community? And as a whole, how is it going to strengthen the relationship between the UK and your country? You understand? So this is what they want to hear. And in doing so, you can actually even look out for organizations that you want to work with when you're in the UK. You could, for instance, you could say this person's organization, this person I met in a conference a few months or years back. Once I'm in the UK, once I'm within the children community, once I establish this network for the persons with disability, I am going to reach out to him and then strike a partnership for people with disability who are in academia, who are doing one work or the other in my country, and also create that bond or that relationship between them and children scholars in the UK from my country who are disabled. And they use that connection to actually establish relationship between these people who are disabled in the UK and their schools, and if possible, with the UK Foreign Commonwealth and Development Office here in the UK. By describing all of this, you could say by doing this, you believe that it's going to help strengthen the relationship between the UK and your country. And in everything, mention names, mention the names of organizations, mention the roles of these people. All of this give credibility to your story. If you don't mention their names, if you don't mention their roles, if they cannot verify the names of these people, then there is no credibility to what you're saying.
Yes, very important, like you said, not just Chevening community, but then Chevening community is still the UK and your country, you understand, and everything. So please try to make sure that you mention people's names, organizations, people that you've not even reached out to, that you're going to reach out to, people that you already reached out to, that you hope to continue working with, and all of that. So because that gives more life to your story. All right. So guys, I think we are clear on how to answer a networking essay.
Yeah, sorry, I just wanted to ask a question on this. I know you touched on it a bit, but I just wanted to clarify something. Like, so the networking question, I mean, can come in two ways. I mean, it may be one, asking for your general networking experience and what you've, shown how you've networked before, and then what networking experience or how you network within the Chevening community, or it can be a combination of both. So I wanted to, like, for me, how it's arranged in my head is I have like points I will give on how I will network in the Chevening community, and then points for how I've networked in the past or how I've shown my networking skills in the past and all of that. So I wanted to just know, how do you, these questions can be framed in different ways. How do you approach it? Should you always just ensure that you have a good mix of both and then give more time to one or the other depending on how the question is framed? Like this question you asked now, I think it kind of focused more on like the Chevening community, how you network in that. So is it that I should just touch a little bit on what I've done and then go to town on Chevening, or how do you strike that balance?
So for me,
okay.
Yeah, so I would say, so if the question includes the Chevening community, then give a lot of emphasis to it. But if the question was more like your broad networking experience, you should also touch on the way I did it for my own. This thing was talking about a brief highlight of my networking experience using just one or two examples, and then talk about how I'm actually networking currently, and then the future application of my networking skills, which then, because it's Chevening communities, the UK, I also brought in the UK and the Chevening community, and then how it was going to strengthen the relationship between the UK and Nigeria. So no matter how the question comes, just make sure your question, your response covers this broad spectrum of your past networking skills and experience, your current networking skills. I mean, if you have one, and then how you're going to apply the networking skills and experience, or leverage your experience, your contacts for the time you are in the UK, and then how that is going to tie into strengthening the relationship between the UK government and Nigeria. Because at the end of the day, this Chevening scholarship, one of the key objectives is to strengthen the relationship between the UK government and the different countries where the scholars are from, right? So it's important to keep that in mind when answering the question. So no matter how the question comes, just include each of these in your response. But if the question then says within the Chevening community, then you can then hammer on that after you've touched on your past networking experience and then your current skills, and then
Okay. All right, Chris. So let me just break it to you. No matter how they ask the question, you have to mention the both. Like no matter how they ask the question, because the funny thing is they are going to grade you on the both. Do you understand? Yes, no matter how they ask the question, no matter how they frame it, that okay, they can frame it that okay, we noticed that you're quite experienced, you're an expert in what you do, and so how do you intend to affect the Chevening community with your networking skills, or how have you been impacting people, or how have you been causing change, or how have you been influencing people with networking? It could be anyhow. You have to make mention of what you've done before, how you've used your networking skills in the past, and how you are going to use it in the future within the Chevening community, how you would use your networking skills to strengthen the relationship between Nigeria, which is your country, and the UK. You must also look up what Chevening or the FCDO is doing in Nigeria or your country. Do you understand? You must look in what they are doing in your country and how what they are doing in your country with your own networking skills, how you can make that work. How your time in the UK would strengthen the relationship between Nigeria and the UK. For me, I mentioned things like exchange programs within my school and the school I'm going to. That's a relationship building. I mentioned things about Chevening Scholars, doing stuff like this, giving back to Chevening Scholars, prospective Chevening Scholars, bringing like Okeychukwu as Chevening Scholar to prospective Chevening Scholars. It's a relationship, right? Do you understand? It's networking. So all of that are the things that you should mention that you can do or that you would do. You're working as let me say program manager, right? Around malaria and stuff. So you can talk about the fact that maybe malaria vaccine that is coming up, how your time at LSSTM is going to probably, maybe you're going to volunteer as one of the malaria consortium, how you're going to work with that and partner with those in Nigeria, how you're going to share knowledge, how you're going to share maybe the knowledge of the development of the malaria vaccine to then maybe replicate that in Nigeria. You understand? Like, just talk about, think that you're already there, right? Think like you're already in the UK, right? Think like you have all the leverage. Think like you have all the connections. You've met all the people you need to meet, all the important guys, all the big guys that you need to push whatever stuff you want to see changed, right? Then just say what you want to do with them. Do you understand? That's just it. That's just it.
Yeah, I think for this malaria stuff, right? I think the malaria vaccine is a very big area you can actually touch on. So just look out for what if the UK FCD or the UK government is playing any role in malaria vaccine research or rollout in Africa and even in Nigeria. So David is the one doing that. His foundation funded that stuff, right? I made mention of this to NATO at some point. Rural health can actually play a role in malaria vaccine rollout in the future. So just find a way to just look out for any information that links the UK government with that malaria vaccine in Africa, and then maybe say bring in how well health can play a role in that in the future, right? Based on the fact that you guys have a lot of data, malaria incidents based on your community. So that can actually be a very good touch point for malaria vaccines to be rolled out.
Okay, so my name is Ruth.
So the UK government is playing a role that can help strengthen the relationship between Nigeria and the UK.
Okay.
All right.
Thank you so much for that.
I think we've touched on the networking question, and so let's just move on to so this last question, right? Studying the UK and career plans, right? We are going to do it together so we can finish early. But please, they are different. Do you understand? Like, the problem is that this question is actually intertwined, but it's different. Like, it's very different, but you can easily mistakenly intertwine them because they are not so far apart. That's why I want us to answer them together, and because of time also. But please, when you are answering them, like when you are maybe going back to prepare for your interview proper, kind of like separate your answers and make sure that your answers are individual and you don't answer the wrong question when they're asking you. Do you understand? Like, so the third question is about studying the UK. Let me see if I have the question here. The third question is about studying the UK. I'm not sure if I have the question. Okay, yes, I have it. So the question is, outline why you have selected your 3 university courses and explain how this relates to your previous academic or professional experience and your plans for the future. So in essence, what they are asking you to do here is that you've chosen 3 courses, you've chosen 3 schools. Now, we know that you're a doctor, you're an academician, you're a nurse, you're a public health person. And now, let's say you're a nurse, you've chosen nursing in the UK, you're a doctor, you've chosen public health for development, you're a doctor, you've chosen maybe healthcare, health policy, planning and financing. How does this relate to your previous academic or professional experience and your plans for the future? Simple, that's just it. So in this question, what you're going to be saying is, show in your previous experience, these are the things that are important that you should show. In your previous experience, show that you've done things like, say, research, right? If you've done them, please state it. Research, published research, or not just research, published research. If you've taken courses online, you've taken courses to develop yourself, because it's not in the question, quite all right, but please, you should mention them. If you've identified gaps in your own knowledge and the realities of the problems you want to solve, how you've identified those gaps, and how you are hoping that with your studies in the UK, you are going to fill those gaps, right? Also, show that you are committed to personal and professional development. Then, in a way, I expect that everyone here should have gotten offers from their schools and everything. Please, if you've gotten offers, mention your offers. In fact, you'll have uploaded offers to them, but please still mention it that, okay, because of you got this offer, because you've got that offer, this is the school. Because at this point now, you should have decided on the school that you are going to attend. So you shouldn't be here saying that, okay, you have choice 1, choice 2, choice 3. Of course, you should have choice 1, choice 2, choice 3. But at this point of interview, you should be like zoning into one school, or at least 2 schools, and maybe no more than 1 course. So you must have, and yes, very, very important here too. When I say zoning into 1 or 2 schools like that, so what it means that you must have done your research properly on these schools, and you must show that you've done your research. So, for instance, if you want to study maybe public health in maybe University of Nottingham, you must have mentioned the reason why you are going to Nottingham to study public health. Whose work is it in Nottingham that interests you? What do you want to do in Nottingham, and why Nottingham? You must also mention things like some of the learnings that you would get in terms of knowledge and skills. In fact, this was one question that they asked me, like as a follow-up question. So after answering everything and pouring all the stuff out, they were like, okay, what are the skills that you hope to learn from the UK, from your time in the UK? Do you understand? So you must also note that there are skills components and there are knowledge components of your learning in the UK. So you must mention some of those things. People that you want to work with, you must mention them. And these are the things that I think are very important in this question. So quickly, I'll allow, who spoke last? I think it was Suraksha that gave a response last. So we'll allow Chris go this time. Can you guys hear me?
Yes, I can hear you.
Okay, I think Dotun, is Dotun still there? If Dotun is still there, Dotun can just be. Sorry?
No, I was going to say, yeah, if somebody was ready, the person could.
Yeah, I don't think Dotun is there, but if you are not there, if you can't speak, then maybe Suraksha should just speak.
No, I can actually.
Okay, all right, just speak then.
All right, thank you for that question. Can you hear me?
Yes, yes, yes.
All right, thank you so much for that question. Ooh. So I have great interest in improving health systems, especially in the areas of health access, policy, and then financing. Those are the areas where I have great interest, and those are the areas my previous work has been involved in. Currently, I work with a micro insurance company that provides financing options for vulnerable groups to treat and cover leading drivers of morbidity and mortality, such as malaria and typhoid fever. And I currently oversee operations and ensure that this options and these management plans are affordable and accessible to the groups that need them the most. When I started reaching out or started contributing to improving health systems in the country or in my community, right from my time in medical school, I did notice that there were certain knowledge gaps that I needed to fill to enable me be more effective in the goals I wanted to achieve. And so I began to take the next, simple step available, which was taking online courses, especially in the areas of policy and financing. And so I took a couple of courses, including the Global Advocacy, Health Advocacy and Policy course from the University of Washington, Leadership and Management course also from the University of Washington, Health Financing course from the WHO, Health System Strengthening from the Global Nussel Institute for Global Health in Melbourne, Australia, as well as Health Management from Harvard University. These courses sort of began to lay the framework for me and introduce me to what it actually meant to influence health policy. I got to prepare a policy document, when as part of the requirements for my course in global health policy and advocacy. And combining that with my experience, working in health systems, it did lay a solid framework for. I believe it has laid a solid framework for the current master's programs I'm pursuing. My first choice is a master's in health policy, financing, and planning at the London School of Hygiene and Tropical Medicine. And I selected this course in line, of course, with my previous experience, like I mentioned, and previous learnings, but also because first of all, the London School of Hygiene and Tropical Medicine is a global leader when it comes to public health. They are currently ranked number one in the UK and third globally. And so it makes it a very, very good fit, and I believe a very, very reputable institution to learn about how to create, financing options and policy health improve health policy in developing communities. Some of the course modules that they offer at the London School of Hygiene and Tropical Medicine are very important to me. One of them includes the economic evaluation for health. Now, this is an important module because we see that we can't separate the economic situation of a people from their health habits or their from their ability to afford health services, especially in Nigeria. Currently, we are seeing inflation rate at 17.5%. People barely have enough to feed, and so a lot of people are not even don't even have enough to pay for health services. And so this shows the importance of you when you are thinking of creating a health intervention or improving health financing methods. You have to pay critical attention to the economic situation. And so I believe that course on economic evaluation for health is critically important, especially as I seek to create change in Nigeria, where economic challenges do impede and affect people's ability to afford health services, as most of the health services are done out of pocket. Another course that I think is really important, another course in the program that I think is really important is there's a course that has to do with politics and health. Yeah, politics and health strategies. And I think that course is also important as Nigeria is going into an election year, and we have seen in time past where government policies have affected, health programs and health interventions. And so I believe, the course teaching and explaining how to navigate political changes as you seek to create health interventions will be important to me to, execute the changes I want to, execute in my country. I am also interested in working with Tracy Chandler, who is the course coordinator. She has quite a vast experience in vaccine development in Haiti and, also, in introducing and developing vaccines and along those lines. And I believe working with her will help me learn about what it entails in, introducing programs in a developing country. I mean, Haiti was affected by war quite recently, and her experience in that field will also help me learn how to introduce health interventions. How did she get those people to accept vaccination after through such a traumatic time? I believe, learning from her and her experience, years in research, working in health policy space will be instrumental in implementing health policy in Nigeria, where we have certain parts of the country that is affected by, civil unrest and things of that sort. My second choice is, okay, so please, this was my second choice, but I'm changing it, but let me just say that for now. So my second choice, is global, is for a master's degree in global health policy at the University of Edinburgh. The University of Edinburgh is one of the oldest universities in the UK, and a member of the Russell Group. The Russell Group is a group of 24 top universities in the UK that contribute the most to health, the most to research in the UK, and then of course extrapolating it in the health sector will be contributing significantly to health development research. And the program at the University of Edinburgh focuses on strategies, for health interventions in developing countries, and I look forward, to learning from that. They also have career fairs where they get to, during your program, you can go for career exchange programs where you get to meet other people who are more established in the field where you want to develop, and also get exposed to opportunities after your time of study. So I look forward to that as an advantage, where I will get to, meet people who have established careers in health policy, and also, make use or take advantage of that to learn about opportunities that exist within that space. Also, the entrepreneurship, the innovation program of the student body in Edinburgh gives you an opportunity to create an innovation, create a solution towards a problem, and then of course share it, and share it with the community, and you can strategize, get feedback from different members of the student body about your innovation and about your solution. I think that's something beautiful, because as I intend to plan and create programs to improve health financing and health policy in my country, and I intend to take advantage of that, to as a testing ground or as a learning ground, to be able to test some of the ideas that I have. One of the ideas I'm thinking about is how we can make a merger between traditional financing tools and health financing tools, because one of the constraints we are having in Nigeria, for example, is that people don't see the importance of health insurance, because it means just putting my money away. What if I never fall sick? That money never comes back to me. But what if we create an innovation or a solution that merges the regular practice that people have of saving, and then maybe the interest accrued on it can now be used to cater for health needs. That way your money is working both ways for you. So those are some of the ideas I would like to test as part of the innovation program at the University of Edinburgh. In addition to that, Edinburgh has wonderful historical places like the Edinburgh Palace, and coastal cities which are similar to what I have here in Lagos. I intend to take advantage of that. And so yeah, these are my choices. Thank you very much. Before you comment, I just want to say that my second choice was for the same program at LSE, but I realized that it's a joint program, so I'm changing that choice, and I'm in between whether I should say it in my interview or not. But that's that. Thank you.
Okay, I don't think you need to change it, right? Or you could is there a need for you to change it?
I should just say it, Abi. I don't know.
So can you hear me?
Yeah, I can hear you.
So the Health Policy Planning and Finance program is a joint program between the London School of Hygiene and Tropical Medicine and London School of Economics. So you take 8 modules, 4 at LSE and then 4 at LSHT. So you're mentioning some modules and some course module organizers. I think it's very important to cross-check and get the information correctly, so that you don't run into a problem when someone Googles it and then they don't find it.
Sorry, we can't. Okay, Chukwu, I don't know, maybe it is the device you're using, but the network, just sometimes your voice will come out, we'll not hear sometimes.
Can you hear me now?
Yes, we can.
Yeah, so I was saying it would be important to or helpful to cross-check the names that you're mentioning and even the modules, right? So yeah, so I think you are trying to say health. So there's a module known as health policy process and planning at LSHTM, which people on that health policy planning and finance master's program take. There's also the health policy module at LSC that you can take, or the one at LSHTM when you're selecting your courses, your modules. So, and then also maybe focus on the intended learning outcomes. So for the health policy, it's not basically around, elections are quite okay, but maybe I understand that maybe you're still yet to enter. So it's quite difficult to capture what some of the modules are in terms of their learning outcomes. But for health policy, for instance, maybe you can focus on maybe one of the things the module teaches is um, being able to sort of leverage the different models or frameworks in policy making to get your policy on the agenda of the government, right? So there's a topic known as setting the policy agenda. This is where you then talk about the different frameworks for getting an issue on the policy agenda. There are different frameworks or different models, right? So you could say on a highlighting basis to say, okay, this module is going to sort of arm me with the skill set to actually get policies onto the government agenda or to push policies and frame challenges or frame problems in public health in a way that it will be receptive to the government. That's one of the things you learn in the module, being able to frame, because you learn that for a problem it can be framed in different ways, that and then the way you frame an issue can actually contribute to it being accepted or rejected. If you frame it in a way that aligns with government's interests, you can get it to be adopted by government.
Yeah.
If you do a poor job in framing that problem as an issue, then it will not fly, right? So that's one of the things you learn from that module. Then you made mention of economic evaluation. Economic evaluation is basically around, because that's one of the modules I took. It's basically around trying to ensure efficient allocation of scarce resources. So in a low and middle income country like Nigeria, where you have a lot of competing needs, how would you inform government to allocate this resource to an area of the health system that will yield the most beneficial outcome? And that's where you have to now start learning about how to do a cost effectiveness analysis. But the broad objective is to be able to inform government to allocate the scarce resources it has efficiently areas within the health system that actually will yield the greatest health outcome. So maternal health, for instance, child health, infectious diseases like malaria, these are areas that, I mean, once you invest in them, the reduction in burden of disease and mortality is actually going to yield a very big health outcome compared to, say, you want to invest in some fancy stuff. Or maybe the way we in Nigeria apparently, where people just invest in different things without looking at the economic implications. Maybe you can say, okay, this cost will actually set up the unit to actually ensure that any investment that is made in healthcare is made based on rigorous, what's it called, analysis that informs that this investment is made to actually get the best outcome for it. Right? So that's what the module is all about. So it's better. It's always very good to be very clear and accurate in the information, so that you'll be speaking to someone who is a health economist as one of your panelists, and then when you're not saying the right thing, it may actually
they'll look at you
play
as someone that's unserious.
exactly play against you. Like, let me give an instance. In my own case, I'm in one of the questions that required me to one of the questions I was asked. I made mention of the Lafia program and how my position was looking on it and everything. Funny enough, one of the panelists, is actually one of the program coordinators for that Lafia program in the whole of Nigeria. He's the one working with FCPU to actually, what's it called now, interface with different implementing partners in Nigeria who were what's it called, awarded grants to implement the program in Nigeria. and he was busy with his iPad. I didn't know what he was doing. But when I checked him out on LinkedIn, I found out that this was one of the positions he occupied. So imagine I was just saying, making things up. That would have been like disaster. So that's why it's important to ensure that you get your information as accurate as possible, because you don't know the background of who.
Yeah. Yeah, I think it's important. Yes, that's very correct.
Also, maybe I think the question that he just answered was more like studying the UK question, right?
Yes.
Yeah. Okay. Yeah. So I would also say, I think you made mention of some of the things in your second example. That's the University of Edinburgh, where the innovation program or the placement program. Yeah, it's very important to touch on those things, and if it's possible, also you have an idea of what you want to explore in your dissertation, you can also bring that in, then related to how to your past experience in Nigeria or in your country, for instance. So if you have been working on something like malaria or the economics of investment in malaria elimination program, for instance, maybe you can talk about something that relates to that as one of the things you want to explore in your dissertation or in your degree research project, and say, okay, this is why you want to do that. You believe that if you're able to do this and go back home and then you will try to push it towards policymakers and see whether it's going
to. Yeah. So I think we've covered this question already. Like Okeychukwu has said, the most important thing is do your research. And I mentioned earlier, actually, all the points I was going to say was what I mentioned before you spoke. So do your research properly. Learn the skills and knowledge you want to get or you want to gain from the schools you've chosen. Notice the gaps you've identified and mention them, because why are we sending you to the UK to go and study if there is no knowledge gap, right? Do you understand? And notice how you in the UK would get some of these things, how you are going to work with people there, and why. I used to tell people, why Chevening, why the UK, why the school you've chosen, why you. Do you understand? So if you can answer those four whys, why Chevening, why not MasterCard, why not Erasmus Mundus? Somebody got Erasmus Mundus today, like, and he did not get Chevening. Do you understand? So why Chevening, why the UK, why your school, and why your course, and why you. Do you understand? So if you can frame your answers around that, you would do well. I think. So actually, yes, are you still there? So at least, I'm sure you're getting all of this.
I think I would also want to say, so this is part of this is like one of the questions in interview that can come with so many follow-up questions. So you could just say, why did you choose your three schools? And then you give all these answers. And then the follow-up question would then be why Chevening Scholarship, like Tolu has said. And based on your experience, why do you even need to go for this master's in the UK? Why not go to the US? Or why not go to any other country? So why did you choose the Chevening Scholarship? So it's also very important to have some kind of response as to why Chevening is your preferred scholarship compared to other scholarships, right? Secondly, why the UK for it? What makes the UK special compared to going to the US or Australia for your master's, right? That is also one follow-up question that could come after you've given your answer as to why you want to go and study these courses in your three chosen schools. I think
an answer to some of those questions. An answer to some of those questions about why Chevening, why the UK, and all of that. Let me just give you a tip. You can say things like Chevening is the most prestigious scholarship in the world, right? We know that Rhodes is a prestigious scholarship, and Rhodes takes only first class, grads, and everything and all of that. But to us, Chevening is the most prestigious scholarship.
I think I would say to add to that, right? Maybe we would always say Chevening is the most prestigious scholarship, but you can go beyond that to say, okay,
Yeah.
like for me, one of the answers I had in mind if I was asked that specific question was, I mean, the flexibility with Chevening scholarship. When you look at many other scholarships, there's a limit to the number of courses or whatever you can study.
Yes.
There's a limit to the number to the schools that you can apply to. But for Chevening, I think you can apply to virtually most
Any
of the,
school,
I mean,
any
top
course.
schools in the UK. Any course example. That's an example.
Yeah.
That's what sets Chevening apart, right? That flexibility to choose, like apply to any school or to any course, sets them apart. And the emphasis on Chevening, you coming back to your country to actually contribute to this development, helping to strengthen the relationship between the UK government and your country's government, is also what sets Chevening apart. Many of the scholarships, they don't care if you finish and then stay back or whatever. They don't care about that. But Chevening is very keen on that. And then the third thing that sets Chevening apart is its emphasis on network. And it shows
to mention that
throughout.
also.
I mean, from the fact that once you win the scholarship, they want you to publicize it on social media to create awareness for people to also benefit, set them apart. The different summits that they have in the UK for Chevening scholars, set them apart. The alumni network that is very strong in different countries sets them apart. And then people have been able to secure job opportunities through these alumni networks, right? So when you begin to say all of these things, I mean, they will know that you've done your research as to why Chevening is your preferred scholarship compared to other scholarships.
Yes. Then another option is also about why the UK. You can mention things like ranking of universities. You can mention things like snow, right? It can be mundane, but I can tell you it's true. You understand? You can mention things like snow, the weather of the UK, because you can say, okay, the weather of UK is temperate, this, you like it. You've been dreaming to see snow, to take a snow picture, a wet Christmas, all of those white Christmas, all of those things. You can mention that. You can mention the nice life in the UK. For instance, you that are going to LSSTM, you can mention the fact that, okay, yes, London has a very good mix of various ethnicities and
very diverse.
Yes. You can, and please always mention the interdiversity, like the multicultural the diversity in across UK community. Actually, in all schools, they make it compulsory to have quite a number of how they call it now, diverse population. They try to do that balancing when they are in their admission. In fact, I was speaking to our dean on Monday. Was it on Monday? One of these days this week, and he said it that when they are taking applications and everything, they ensure to, when they've taken enough from one continent, they stop admissions from that continent, then they look into other continents, and it's to ensure that there's a mix in the class. Do you understand? So it's one thing that the UK does. I don't know if the US does it and everything, but you understand. So that's something that you can also mention. Then you can mention the fact that, okay, there's maybe a monument you want to visit, there's a place, maybe a festival you want to visit in the UK. Maybe there's this show or a conference or something that you've been longing for that is happening in the UK in 2023, right? That you want to attend when you're in the UK. Even though it's not in the UK, if it is maybe in Europe, you can mention it that, okay, being in the UK will give you ease of access to attend this conference. Like for some of us attended, what was this conference now? COP, yes, COP 26. You understand? Some of my colleagues attended COP 26 this year because they were in the UK. So you can also give that kind of example. If you have maybe something happening in the UK next year, a conference like a public health conference was going to happen, and I mentioned it that, okay, yes, by May this year the conference is going to happen, and I'm going to attend. So stuff like that, you can mention it in your answer. You probably did not mention it maybe in your essay because probably there was no space to mention it, but then you can also always mention it when you're speaking.
Even as things as simple as, I mean, your favorite football club, if it's an English football club, or even if it's a European football, another country football club, you could say maybe during the Champions League they're going to play something and you want to go and watch it in person. If there's a novel you really like and then the author is British, you could say maybe if the person is still alive, or even he has a monument or a library named after him, you say you want to go visit that library,
Yes.
like have a first-hand experience of people who have
Yeah.
this author. Those kind of things will actually
Things like
have an interest.
things like Harry Potter, you understand? You know the fan base of J.K. Rowling from Harry Potter series, Shakespeare. You understand? William Shakespeare's birthplace is just like 30 minutes away from where I school. Do you understand? Stratton upon Avon, and it's something that you can mention that okay, I want to go to Coventry because William Shakespeare's birthplace is there, and I want to visit the place. There's Warwick Castle here. I want to visit Warwick Castle. So those are things that you can mention. So guys, please make sure that, because it gives life, like we say, it gives life to your essay. You understand? It gives life to it. Because don't be deceived. You will not be in the UK and you just sit at your house alone. You will travel, you will meet people. You understand? All right. So the last question is really talking about your career plans, right? And so what the question is usually constructed in this way, like Chevening is looking for people with clear post-study career plans. I don't have a question with me, but usually it's just about your career plan. So the way to answer this question, so okay, I'm coming just
I think it could just be, you can ask it in different ways. It could be okay, what do you intend to do like after your master's in the UK, right? That the question can just come as simply as that. Or what are your plans following your studies in the UK? Or how are you going to use the skills you acquired from your master's education in the UK to improve, to make a change in your country? So these are the different ways this question can be framed, right? And then the popular way to answer it is to break down the plan into an immediate or short-term plan, intermediate plan, and then your long-term plan. You can decide to use the different timelines. Some people say within the first 3 years of their masters, completing their master's program, then between 3 to 5 or 3 to 10 years, and then beyond 10 years. Right? That's how you can actually the outline you could use to then answer questions. What do you think?
Yeah, so guys, it's just clear. Just use the same approach. Immediate term, like in fact, you can even mention something you're going to do while you are in the UK. Please always mention something you're going to do while in the UK. If you have maybe internship opportunities you want to explore in the UK, that would help your practice in your country. And guys, please note that it's very important that you mention your return back to your country. It is, no matter what your desires are, it is very important that you mention your return back to your country. You understand? No matter what your desires are, right? So please make mention of what maybe trainings or what opportunities you want to get while you're in the UK and how that will relate to your work in Nigeria. Make mention, your country, make mention of what you plan to do immediately when you come back, right? Within 1 to 2 years. Make mention of what you're going to do within 2 to 5 years, like Okeychukwu said. Then make mention of what you're going to do, 10 years onward and everything like that. You can talk about things like, okay, you want to start an organization. For those that work in organizations, you want to resume your role and you want to continue your work. For those that are not working in organizations, maybe you want to get appointed into public service, or you want to work in private organizations, or you want to volunteer with multinationals, you want to work with anything, so whatever you want to do within that first 2 years, then solidify on that plan. Please always solidify on your plans. You understand? Don't say that you want to work as maybe special assistant to maybe the governor on health, right? In your first 2 years. Then when you say you want to go into academics after working in public sector, you want to go into academics, then go and teach, then I say, okay, then you want to go into the field, then go and do, no, like it's looking confusing. You can, I'm not saying you shouldn't say you want to go into academics, don't get me wrong, but I'm just saying that let your plan look orderly, such that they see a progression that, okay, yes, this is what you want to do, and this is when you want to do it, and these are the plans, and these are the ways you want to achieve it. they must be clear. That's just what it is. They must be clear. You understand? Those goals must be clear. They call it SMART goals, right? Specific. They must be measurable. They must be achievable. They must be realistic, and they must be time bound. Do you understand? So SMART goals. And it's important that you also mention the Chevening community when you're mentioning your goals. Do you understand? Mention the Chevening community, how maybe whatever program you are doing is going to, maybe how you are going to recruit Cheveners, you understand, to join forces with you to achieve some of your goals. Because don't forget that you are joining a community of over 50,000 alumni. And you have like 50,000 people that you can call you brother or sister. Do you understand? They can call you friend because of you are part of them. So how do you want to utilize that community? They should see that when you are speaking, when you are giving your response. So I really want you guys to understand one last thing before we go. All of what we've said here is actually not in any way the only way to get a Chevening scholarship, right? And it's only our personal view. It's not even like FCDO's view. It's not like anybody here is an agent of FCDO or anything, right? Do you understand? Like we're just trying to see how we can help others to come on this side of the divide.
Yeah, I think is it possible for maybe Surakshia to sort of share with us her
Yes,
reaction?
yes.
Yes,
I'll allow her to speak now. I'll allow her to speak now. So and like I said, everything that I'm mentioning here doesn't have to be all you would say. You can improve on it, you can tweak it, you can, bring your own personality to it. And because when it is personal, it won't look forced. Do you understand? And that is what people would believe. But what we are trying to do is to make you feel natural with your answers. For instance, I was telling Okeychukwu that myself and him, we prepared our interview. We had interview mock, like this kind of mock together when we were preparing. Yes, and that was what really helped me feel natural in my answers. Do you understand? So it's about you feeling natural with your answers. It's not about just knowing everything or doing all the stuff. No, you could know everything, you could know all the stuff, but then you should feel natural with your answers so that when you're speaking, it's going to feel more like a conversation. There was something I learned today because I was on one Zoom meeting before this meeting. And what they said was that even interviewers have anxiety, right? So you think that you have anxiety, you are anxious, that okay, yeah, you're scared of what you're going to say. No, don't worry. Even the interviewers have anxiety. Do you understand? So what you're supposed to do in any interview is to make your interviewers comfortable. They will tell you that their job is to make you comfortable, right? So that you should not be worried. They'll even give you a glass cup of water and everything. But then your one job is to make your interviewers comfortable so that both of you would then have a conversation. Do you understand? When you have a conversation with your interviewers, man, you're going to ace that interview. Forget it. Like, you're going to ace that interview. Do you understand?
Yes,
So please,
they're going to make you as comfortable as possible.
yes, they will try to.
They'll give you pen and paper to even, write down the questions. You have the choice to ask them to repeat the questions if you didn't get it, right? So that you are not confused. So they'll give you pen and paper to write down the question if possible to guide you and even allow you to actually jot down your points and then before you start speaking. Exactly. So anything that will make you comfortable, they will ensure that you're comfortable. Again, I would also say, just to touch on what Tolu said, it's not a do or die affair, right? Chevening scholarship is not the end of the world. It's not a means to an end, actually. So just have that mindset that you're going there to sort of have an interaction with like your colleagues. See those interviewers or the panelists as just any other people you've been speaking to in your professional life, and then try to have as natural a conversation with them as possible. When you have that mindset, every form of anxiety is going to actually leave, and then you're not going to have an interaction. At some point, you get to a point where they actually want to know further what you do, and then you're naturally explaining to them what you do, and they are learning from what you're doing. So, and when you get to that point, your confidence will actually be stronger, and then you'll be able to actually make a convincing argument as to why you should be So it's very important to have that mindset that it's not a do or die affair. I mean, if I don't get it, it's not the end of the world. I will continue doing what I'm doing currently to make myself much better, and then maybe to prepare for the next this thing. But it's when you make it as a do or die affair, if you don't get it, the whole world will end. That anxiety is actually going to make things.
Yeah. So let me just add to this also before we finish, because we're going to close very soon because I have another meeting by 6. So the thing is, mind you, you guys are awesome. Like you guys are like top. Like for you to get to interview stage, okay, you can bear me with this. You guys are top people. Like there's somebody that I know that did not get to interview stage, and he got Erasmus Mundus.
Yeah.
Do you understand? So he got Erasmus Mundus scholarship, but he did not even get to interview stage for Chevening. Do you understand? So it means that like your applications are superb. Do you understand? So if you are put into any application else, you probably would have gotten it. Do you get? So please just have that at the back of your mind when you are going for your Chevening scholarship interview, and I'm sure you're going to ace it. So quickly, Suraksha, in just 5 minutes, so we can round up on time. Please just tell us what your career plans are, and we will not really have time to critique the essay, but at least just speak. Then if we have any questions, we can just ask.
Okay, I'll just go quick, try to be quick. So in Nepal, every person has been guaranteed to right to access basic healthcare services, which is mandated by the Constitution of Nepal, no matter who they are and where they live. But however, it is very easily evident that the smartphone has reached to every nooks and corners of Nepal. But however, those people in the rural areas negotiate their rights to healthcare with the cost of treatment and inaccessibility. The Nepal Living Standard Survey itself shows that there is a gap of 70% in access to healthcare in people with disabilities and without disabilities. And they're more likely to be denied healthcare service and suffer catastrophic health expenditure. So, UK and Nepal has been immensely working since 20 years to provide technical support for the implementation of Nepal Health Sector Support Program, for strengthening the performance of the health system and supporting the sub-national government in the local health system for evidence-based planning and health sector management. So, after I returned to Nepal, with a fresh knowledge and skills of public health and pragmatic experience of learning from the UK healthcare system and culture, I plan to organize a learning and sharing program among the network of the disability groups, youth group, and along with the Chevening network to share the invaluable experience that I've gained in this period of a year. So from this platform, not only I will share my experience, I will learn from them about the context of Nepal, what has changed from the time I left Nepal and what needs to be done. So this will support for my preliminary research on equity related challenges in Nepal before and after and look into the data gaps to figure out the priorities for action. In 1 or 2 years, owing to the national health policy of Nepal that really emphasizes on strengthening the primary health centers which deliver accessible health service, and it is the first point to reach for every people to receive health service. So I plan to work in local healthcare system through UK aid support, as it has been providing technical support to 39 municipal health offices for strengthening the local health system. So I plan to join one of them and also coordinate with a disability organization and build a strong network with the municipalities through the mobilization of disability leaders. I plan to build a tie with municipal health office and inclusive partnership with other sections of the municipality, where I can conduct a discussion program to highlight the issue of health inequalities and seek political commitment for equitable health access delivery. So as that will be the time that Nepal will be forming new, having elections and having a new political parties into the health policies as well. So it is a great time to influence the parties for political commitment and seek resources from them. So with the collaboration, I'll conduct a systematic implementation research learned from the course to explore what and how within the health system has affected the delivery of healthcare services and explore the implementation challenges of health policies. So with this, I'll critically analyze the factors to understand what has worked in the past and what needs to be done. So impact, and Alongside, I also empower the communities and promote the engagement through community-based participatory research and understand the health needs and bring them into the table of discussion to devise the health plan of local health of local municipality. So this will help to strengthen the demand side and also the supply side to make responsible for health. So the evidence generated will help me to bring evidence-driven health policies and health programs to access delivery of healthcare among the vulnerable communities. And this evidence will also help to devise health initiatives from the local communities and build innovation in healthcare to meet the health needs and strengthen primary healthcare. So in the long term, in 2 to 5 years, I definitely want to work more on innovation processes in healthcare, which I'll learn from the UK healthcare system as well as through my course. So as Nepal is very new in developing of health technologies and healthcare innovation, I want to undertake a proposal on developing of health innovations as health, telemedicine, and carefully do a research on its implementation, scale up, and its effective use. I'll put the proposal to United Kingdom Government Partnership for Health, which supports this kind of which supports equal access to health for all. So I'd like to collaborate with Tropical Health and Education Trust, which is supported by UK Government Partnership for Health. In 10 years of time, I see myself working as a senior administrator at the Ministry of Health and Population in Government of Nepal. So as a Ministry of Health and Population is responsible for overall policy formation, I definitely like to work for health sector strengthening with the reforms through combining evidence with the local roots and insights, preparing guidelines for policy intervention with the lens of equity and inclusion. The modules and course that I learned in UK will really help me to translate the policy into practice. And with my previous work in ICT, I will also develop an integrated monitoring and evaluation framework of all the policies and programs that will be undertaken to access healthcare delivery services. So yeah, that's all I think.
All right. I think you did well. But one thing I just wanted to highlight is going to be the exact skills, right? You mentioned a lot on knowledge. You mentioned some skills also, but some of them were a bit general, right? They were a bit generic. Like you said, you mentioned something about is a course module and what's going to help you with. You mentioned something about maybe what you're going to, a skill you're going to learn from this module and everything and all of that. Yeah, you can go like more specific. That would be better, right? And but I think largely it was a good one. It was a good one. Okay, Chukwu, yeah.
Yeah. So in your long-term goal, you made mention of the position you are going to occupy. I think senior administrator, so which is nice. But I didn't hear that in your short-term and intermediate-term goals, where you made mention of UK8. You're going to join UK8, but you didn't mention what position you are going or role you are going to play within UK8 to sort of work on the things you made mention that you're going to work on. Same thing when you talked about your intermediate plan goal. You said you are going to write a proposal or something, but you didn't make mention of whether it was still going to be while you're working with UK8 or with another organization, and in what position or capacity you are going to be functioning to be able to come up with such a proposal. I think those are specific things you need to actually bring it to make it more realistic and then make
Your voice is a bit breaking. I can hear a little, but I'm missing in between.
Okay, sorry. When did you lose me?
I think when you mentioned about after your role in UK and what will you do after that, I missed it.
Oh, okay. So I was saying that yeah, for your short-term goal, you made mention that you're going to work with UK8, right? But I didn't hear what position or in what capacity you are going to work with UK8 to actually carry out the functions that you actually listed. So it will be important to mention what role you are seeking within UK8 that will enable you to carry out the the functions or activities that you mentioned. Same thing applies to your intermediate term plan. You made mention of writing a proposal, right?
Yeah.
So is it within UKAID or with another organization? And in what capacity or role are you going to, will you, or what role will you occupy in that organization to be able to sort of write, develop such a proposal? So those things will be important to make your story realistic and credible. Yeah.
All right, guys. So I'm really sorry we have to go now.
This was the best thing.
It's actually been a very, very long time. I think we spent 3 hours. We started at about
Yes.
3
Yeah.
yeah, and we're here till 6 o'clock. So that's actually a very long one. But at least with this, I hope that everyone has a very good grasp of the answers that they are going to give at the interview. And I'm certain that with this time that we've spent with you guys, by this time next year, you guys are going to be in the UK doing this same thing for others. Do you understand? So I really believe that you guys are going to ace the interview, and I'm going to, because we recorded this session, so I'm going to share it with the others also. Thank you for coming, and we hope to hear good news by July. It's June, July, right? June, July, that's when we get to hear information. Right. All right, guys, so take care. Wish you all the best. I'm available. You guys have my contact. You can always send me a message. If you need to get to Okay, you can always send me a message. I'll link you up with him. And that would be all from me. Yeah. Thank you, guys.
Thank you so much. I love to
All the
connect.
Yeah,
very
thank you
best.
so much, Tolu.
Yeah.
Yeah, thank you,
So
Okeychukwu.
thank you,
Really appreciate
Okeychukwu, for
all
your
your feedback.
time. It was so worth it. It was so worth it. Thank you so, so much. Thank you so, so much. Like, I really, really appreciate it. I know you can be very, very busy, but then
No
thank you for
worries.
granting. Thank you for granting
Thank you
this.
so much, both of you.
Yeah. All right,
Thank
guys.
you so much. Thank you. Yeah.
So can you
Before you go, I
please
was going
give
to
me
ask,
Twitter
can we?
ID? I'm connected with Tolu because he was the one who organized all this. So thankful to him. But yeah, I just don't know how to pronounce. But Okeychukwu, like, can you give your
Yeah, you got it correctly. Yeah.
Twitter ID? And yeah, it was great to connect and
Okay, yeah. Twitter ID, right? Okay. I think we can just drop it in the chat box.
Yeah.
Let's remember my
Thank you so much, Tolu. It was great. Thank you so much.
Yeah. So my Twitter,
Yeah, thank you so much, Tolu. Okay.
Okay, corporation or something like that. I can't remember now.
I think I've changed it.
Dr. Okeychukwu. Okay. Seen it. Yeah, thank you so much, Tolu, and thank you so much, Okeychukwu. It's been a really, productive and insightful session. I really appreciate all the feedback that has been given. There's still a lot of work to be done. So is to go back and of course work on the things that you shared. I was going to ask if we could have, for me, my interview is still a little further down, 28th of April. That's my interview date as it stands. So I was just going to ask if we have one more, probably closer to the interview, just have like one more session if that could work.
Well, that would depend on our schedules.
Yeah. So
Sorry
for
for
me,
being
right?
a twist.
For me, right? I think I have one, but it's not yet finalized. It's not yet. I haven't yet concluded whether it's going to happen with someone. Um, that should be on the 4th of April. I think so.
Okay.
3rd of April. Any of those two. Yeah. But if I just remind me, right? If I finalize that, then maybe you two can also join.
Okay. Yeah, I'll really appreciate that. Appreciate that. Thank you so much.
All right, guys. So I have to join my other class now, please. Thank you.
Yeah. Bye-bye.
All right. Take care. Yeah. Thank you so much, everyone. Thank you so much.
Thank you, everyone. Bye.
Yeah. Bye.
Yeah.